you been told that your child with cerebral palsy needs Botox injections to reduce the spasticity in their muscles so that they can function better? Did you know that radial shockwave therapy is extremely effective in reducing spasticity in muscles of children with cerebral palsy without any negative side effects? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share with you the top 3 reasons why radial shockwave therapy is far better than Botox when it comes to reducing spasticity in muscles for children with cerebral palsy. So here at My Favourite Physio, our little ones with cerebral palsy do not have Botox injections. We strongly recommend that our children don't have Botox because of the side effects of Botox injections. Studies now show us that Botox injections actually denervate muscles. That means that it kills the nerve endings to the muscles and damages the muscles for good. They cause muscles to be replaced with fatty tissue, which means that the muscles get weaker over time with repeated Botox injections. And these changes are permanent. They do not reverse over time. It gets worse over time with repeated Botox injections. So instead, here at My Favourite Physio, we recommend radial shockwave therapy for our children with cerebral palsy. And the reason for that is because 3 things that research has found. Firstly, radial shockwave therapy is extremely effective in reducing spasticity in muscles for children with cerebral palsy, even after 1 single treatment. Studies have shown that the impact of reducing spasticity lasts for 4 to 6 weeks and even up to 3 months after 1 treatment. Number 2, studies have shown that radial shockwave therapy actually effectively increases ankle range of motion when it is used on calf muscles to reduce spasticity in children with cerebral palsy. So they increase the ankle range of motion, allowing them to get their foot flat on the ground. And that's one of the reasons why doctors always want Botox injections for children with cerebral palsy. Because spasticity in your calf muscles makes you go onto your toes, which means that they can't get their foot down, their foot bones all get twisted. So they want Botox injections to reduce that spasticity so that their ankles can come down flat. Radial shockwave therapy does that. Number 3, studies have shown that the gross motor function and skills of children with cerebral palsy improves after having radial shockwave therapy. So they have more long-term improvement after having had regular radial shockwave therapy to their leg muscles. So that change has been seen to persist up to 3 months after treatment, which is fantastic because radial shockwave therapy is non-invasive and it doesn't actually have any negative side effects. All these studies have not found any negative side effects from using radial shockwave therapy. So that's a great bonus. So if you've got a child with cerebral palsy and you don't want them to have Botox injections, why don't you ring us here at My Favourite Physio? Speak to one of our expert pediatric physiotherapists. Find out if radial shockwave therapy is suitable for your child with cerebral palsy. The number to ring is 02-9790-4233. And if you know somebody out there who has a child with cerebral palsy and they really don't want their child to have Botox injections, or perhaps they've tried Botox injections and it didn't really help their child. In fact, they look weaker and they were worse with their walking. Why don't you like and share this video with them? Until next time, have a fabulous day. Bye.